to progress through, been using my arrow to progress through the screen to see the faces and the names, and many of the faces are familiar as well as the names. So I'm just really pleased to have the opportunity to be here with you today to talk with you about this very important topic. And so I'm going to use a minute here to pull my screen up so we can get started. Okay. So as you are aware, the topic of the presentation today is taking the mystery out of memory medications. As simple as that may sound, there are some underlying mysteries concerning these medications. And so hopefully we'll have an opportunity to clear up some of these mysteries today. So we're going to talk about more specifically the FDA approved medications to treat the cognitive symptoms of Alzheimer's disease. And we're talking now about the memory and thinking. Now, we are aware that there has been some record-breaking discovery, of course, in terms of a new medication that has just been approved by the FDA for the treatment of Alzheimer's disease. And so I'll spend a little time at the end to talk about that. So again, when we talk about these medications, we're talking about medications that have been specifically approved by the Food and Drug Administration to treat these symptoms, the cognitive symptoms of Alzheimer's disease. So we also know that these 5 medications that I'll talk more about in depth are prescribed to treat symptoms. When we say cognitive symptoms, those are symptoms related to a person's memory, thinking, overall language skills, judgment, and other processes, thought processes as well. But it's also important for us to note that these medications are not a cure for Alzheimer's disease, and they can neither reverse or stop the underlying disease process. But now we know that there is hope on the horizon. So we're going to really spend a little time on that as well. So I thought that I would do a review of the stages of Alzheimer's disease. Since we know that these various medications are really prescribed based on the stage that the person, in terms of how they are progressing through the disease process, the trajectory of symptoms per se. So now we know that these stages are also, it's like a topology, more or less, that we can categorize or classify the disease process. And these stages are, classification stages are useful in many ways. Of course, in addition to allowing us to to have a greater understanding of, in terms of what particular symptoms can be expected as disease progresses, and there's more damage to the brain. It helps the person with the disease and the family members to be able to plan more or less in terms of for the present and future, in terms of advanced directives, for the person to have an opportunity to discuss their wishes, with their family members, even in terms of placement and living situations, and also to be able to help the caregivers more or less to be able to understand, in addition to the cognitive symptoms that the person will experience, what type of behavioral symptoms, personality changes and all that can accompany the disease process. But first of all, we need to, mention that although these are the defined stages, we know that individuals will progress through these various stages on an individual, type of basis. And we do know, of course, that the middle stage, they will spend the majority of time in the middle stage of the disease. So when we look at the early stage, that's also referred to as the mild stage of the disease process. And you can see from here some of the symptoms that the person, will experience. Now, oftentimes, the person will notice, some changes in their memory themselves. It may be the case that people that are around them may not really notice, changes that are occurring, and because oftentimes these changes are, subtle. Uh, Oftentimes when the person might express this to family members, or they may start to notice subtle changes, and so then they can seek out some, professional, assistance at this time in terms of, appropriate workup to determine the source of the, changes in cognitive functioning and memory loss, because we know that there are other conditions that can cause, some memory loss as well. So these are some of the symptoms that they may just have difficulty just articulating or coming up with the right word or name per se. And they may even have some problems when they are introduced to new people, being able to remember their name, because we know that the changes in memory, of course, are more noticeable with a recent memory. So then with new people, they may have difficulty, remembering their names. And they may also have difficulty performing their tasks, especially in work settings or social settings. And again, that's going to vary, depending on the individual and, how they are progressing through this stage. But oftentimes some of these symptoms may become a little, noticeable in certain situations. And then, of course, they may, lose or misplace, valuable object, and that will cause concern, with the person who has the condition, in addition to, family members and persons around them. And then they may also experience some increased trouble when they try to plan or in organizing. So if we move to the middle stage, and that's also referred to as a moderate stage of the disease, these are some of the symptoms that we will see, is that the person is becoming, more forgetful of events, and even in terms of their, personal history. So at this time, usually people around them, may start to notice, these symptoms as well, if they hadn't already been, detected. The individual may, have feelings in terms of just being moody or withdrawn. And then even, at this time, they're aware themselves that they are having, problems with their memory. And so oftentimes, that they're really trying to conceal, the memory loss as would occur in the, earlier stages of the disease. And so they may just start to withdraw from social situations, and or to isolate to some extent, because they may feel, uncomfortable. They may have the inability to recall personal information, such as their maybe telephone number, street address. Confusion again about time and place in terms of, where am I, right now, or this place doesn't seem familiar, or especially if they have to go out to, unfamiliar places that they haven't been, in the past, is that it may even be, more noticeable. At this stage, also, the individuals may require some help with dressing per se. And that's example like, how to choose appropriate clothing, based on the season, based on the temperatures outside. And then we tend to oftentimes see difficulties that will arise with controlling bladder and bowel. And so the person may become, incontinent. And then, of course, we start to see some of the behavioral manifestations of the illness, in addition to, sleep disturbances. We may also see wandering. That's more common in this stage. And then also personality changes will occur. And sometimes this might be one of the more difficult stages for, family caregivers. And it's also oftentimes will manifest even in, caregiver burnout. It can start to impact the caregiver's overall health. And sometimes in this stage, the caregiver will have to seek out additional assistance or maybe even possibly some changes in, living arrangements, depending on the overall level of support that the caregiver may have in the caregiving situation. So then if we look at the late stage, which would be the more severe stage of the illness, at this point, the person may require around-the-clock care, 24-hour assistance with daily, personal care. They will also experience loss of awareness of recent experiences, as well as their surroundings. Sometimes in this stage, the person will become, bedbound, may have very limited speech or language abilities. Of course, problems with walking, sitting, and then eventually swallowing due to, areas of the brain that are being damaged. And as I mentioned, difficulty communicating. And this stage, we know the individual is more vulnerable to infections, and especially pneumonia, sometimes even aspiration due to, swallowing difficulties. So that was just a quick overview of the stages so we can put that into context. So we know in terms of these medications that are approved by the FDA to treat Alzheimer's disease is that they help to lessen or stabilize the symptoms. We know that it's not a cure, and usually this is for a limited, period of time. And how they tend to act is by affecting certain chemicals that are involved in carrying messages among the brain's nerve cells. And so we're going to talk more in terms of the underlying and how the medications work based on these various neurotransmitters. So these are the drugs that have prescribed to treat the cognitive symptoms of Alzheimer's disease. And remember, we're referring to basically memory and thinking. So we have one group of medications that are referred to as the cholinesterase inhibitors. And probably the more common one that people are aware of is the donepezil or the Aricept. And then we have the Exelon, and we have the Razidine. Now I've also included the generic name and the brand name. The brand name, you see the little aura by it. So some people recognize it by the brand name, and then some by the generic name. And then we have another class of medication that is referred to as the glutamate regulators. And that medication is the memantine or the Namenda, that you probably heard that name before. And then we have one medication that is a combination of the cholinesterase inhibitor plus the glutamate regulator. And so that medication is the Namzaric. So those are really the medications that have been approved by the FDA to date to treat these cognitive symptoms. So now let's dig a little deeper in terms of taking some of the mystery out of these medications and trying to understand how they actually work. So the first group, the cholinesterase inhibitors, and that's a kind of bulky word, so this kind of helps us to pronounce it, cholinesterase inhibitors. So we know that acetylcholine is really important to the brain. It's an important chemical messenger because it is really needed and is important for memory and learning. So with Alzheimer's disease and the changes that occur within the brain is that it's going to result in decreased levels of acetylcholine in the brain. So now remember, if this chemical messenger acetylcholine is very important for memory and learning, and if due to brain changes that occur with Alzheimer's disease, if this acetylcholine level decreases, then we're going to see some decline in memory and learning, and hence, those are the symptoms that we see. So now the cholinesterase inhibitors are really work to slow down the breakdown of acetylcholine by blocking the action of an enzyme that's called acetylcholinesterase that really breaks down the acetylcholine in the brain. So if we can remember, in essence, that these cholinesterase inhibitors, the ones that I talked about earlier, will slow the breakdown of this important chemical messenger acetylcholine in the brain by blocking the action of a particular enzyme called acetylcholinesterase, an enzyme that breaks down acetylcholine. So then if we can block the action of this particular enzyme, then we can, it can work more or less that there will be more acetylcholine, available in the brain. And so an increased concentration of this chemical messenger, acetylcholine in the brain, is going to lead to increased communication between the nerve cells. So that helps us hopefully to understand how the cholinesterase inhibitors work, because they work in essence to have more availability of acetylcholine in the brain. And we know that acetylcholine is important for memory and learning. And so that's how that particular class of medications works. So again, the FDA approved drugs to treat the cognitive symptoms of Alzheimer's disease, and these are referred to as the cholinesterase inhibitors. So as the disease progresses, the brain produces less and less acetylcholine. Therefore, the effects of the cholinesterase inhibitors, may eventually be lost over a period of time. So remember, I talked about early on in the presentation that it said that these medications may only last for a limited, period of time. Of course, that will vary depending on the, individual, but some of the results will tend to taper off over a period of time, because just part of the normal disease process that occurs with Alzheimer's disease, eventually, more or less, the brain in and of itself is going to start to produce less and less acetylcholine. So now let's look at that other group, the other group of medications that's referred to as the glutamate regulators. And so they target a different chemical messenger in the brain. So this medication, the brand name Namenda, is prescribed again to improve memory, attention, reason, language, and also to help in the ability to be able to perform, simple tasks and tasks involved with activities of daily living. So now look at the difference in this medication is that it is used in the treatment of moderate to severe Alzheimer's disease. And we'll talk a little more about the other stages that the cholinesterase inhibitors target. So we know that Namenda regulates a different type of chemical messenger in the brain that's called glutamate. But this glutamate is also important in memory and learning, of course, as is acetylcholine. So when produced in excessive amounts, the glutamate may lead to brain death. So this particular medication helps to regulate the amount of glutamate in the brain. So let's look at the FDA approved drugs at a glance. So we look at the generic name, we have the brand name, and then the stage of treatment, more or less, that it has been approved for. So when we look at the Donepezil or the Aricept, we see that that's approved for the treatment of mild to severe Alzheimer's dementia due to Alzheimer's disease. So you can see that the Aricept is used to treat across the entire disease trajectory, from mild to moderate to severe. So the rivastigmine or the Exelon, which is the brand name, is prescribed to treat mild to moderate dementia due to Alzheimer's or Parkinson's dementia. So that's really specific to this particular drug, Exelon, is that it's used to, in addition to treating mild to moderate dementia due to Alzheimer's, is also used to treat mild to moderate dementia due to Parkinson's disease. And then what's also unique about Exelon is that it also comes in a patch. And so the patch form of administration is also used for severe Alzheimer's, or to treat persons in the severe stage of Alzheimer's disease. Okay, then we have another cholinesterase inhibitor, the galantamine or the razidine. It's also used to treat mild to moderate dementia that's due to Alzheimer's. And then we have Namenda, and it's prescribed to treat moderate to severe dementia due to Alzheimer's. So you can see in terms of how the medications are prescribed, and so they're also prescribed for treatment for the various stages of the illness. And then also we have the latest FDA approved drug for memory symptoms is the Namenda. And you can see the Namenda is a combination of the memantine and the donepezil medication. So it's a combination. And that particular medication is used to treat moderate to severe dementia due to Alzheimer's. So now let's take a look more in terms of side effects that can occur with treatment with these various medications. So now you can see in terms of the Aricept and Exelon and the razidine, the cholinesterase inhibitors, that there are common symptoms. You see basically the same type of side effects that will occur. And those side effects include nausea, vomiting, loss of appetite, muscle cramps, and increased frequency of bowel movements. So it's always important, especially for caregivers and the person with, Alzheimer's, to be able to, have this information, not only with these particular types of medications, but really with any medication that's prescribed. We need to know, first of all, why is the medication prescribed? What is it targeted to treat? And then some of the side effects that we need to know about so that we can institute the appropriate measures. So you can see with those first three medications, there tends to be more of a GI type of, related symptoms. So now what that also tells us, especially as caregivers, is that we need to monitor more or less the person's, appetite and their food and fluid intake, since we know that it can cause a loss of appetite. And so we want to also monitor their weight more or less to see how it may be impacting them. So we may want to also consider, more frequent, like small type of, feedings throughout the day. And then also to monitor more or less in terms of their, bowel movements, in essence, that they can be, increased and sometimes result in diarrhea. So we want to also monitor the condition, of a person's skin, more or less, to make sure that it's kept, clean and dry, and also to prevent, any type of, resultant skin, breakdown or damage. So now when we look at the Namenda, which is the other class of medications, you see now the symptoms are a bit different. So instead of really the GI type of related symptoms, now we're looking at the possible side effects of a headache that can occur. And instead of an increased frequency of bowel movements, now we're noticing that constipation can occur. In addition to confusion and dizziness. So now that lets us know as, caregivers again, is that we want to, monitor, the individual in terms of, how often they're having bowel movements, if they're really experiencing constipation, they're having to, strain, so to speak, if we need to consider in terms of how we approach the diet with increase in fiber to be able to help, to offset the constipation. And definitely, we want to make sure that the individual does not experience, what we refer to as a fecal impaction. Now, especially with the dizziness, so there are some additional precautions that, we can take especially to prevent self-injury that may be related to falls. So in terms of, just trying to maybe instruct the individual not to, suddenly, change positions, or if they ambulate with a cane or walker, then it will be important to use those assistive, devices. And then of course, to monitor for the, severity of headache, and maybe some other type of medications can possibly be given for those if it does become severe, and then also to monitor for confusion and then the level of confusion that might occur. So now we look at the Namzaric. Remember that it's a combination of the two classes of medications. So we have the memantine and then the Nesapil. So now look at these symptoms that will occur. So you see it's a combination. So not only the GI type of symptoms, but in addition to the nausea, vomiting, loss of appetite and muscle cramps that can occur, there's also increased frequency of bowel movements, headache, but the individual can also experience, constipation, confusion, and dizziness. Now, the good news is that these symptoms tend to, wane over time. They tend to be, time limited. So I also have some information concerning the manufacturer's recommended dosage. Now, this is not to say, of course, that this is how the medication, might be prescribed by the treating healthcare provider, but this is like an overview of recommended dosages for the medications. So for the Aricept, you'll see that in terms of the tablet form, the initial dose would be 5 milligrams once a day. And then it's recommended that the dose may increase to 10 milligrams a day after 4 to 6 weeks if the medication is well tolerated. And then it can be increased to the higher dose to 23 milligrams a day after at least, 6 months. And so it's going to be important during this period of time, in essence, that, the caregiver is also monitoring the person's response to the medication, not only in terms of the, side effects, but how the medications may be, impacting the person's, cognition or their memory, so to speak. Because again, this is important information that needs to be, communicated to the healthcare provider, by the caregiver, and put into context, since you have, interface with the person, usually on a daily type of basis. So now with the Exelon, comes in a capsule form. There's an initial dose of 3 milligrams a day. It can be 1.5 milligrams, twice a day if you break it down into 2 different doses. And then again, you can see that it may increase, the dosage can increase to 6 milligrams a day. And then that can be, divided in doses with 3 milligrams twice a day, or 9 milligrams twice a day, with a dose divided 12 milligrams a day with 6 milligrams twice a day at minimum for 2-week intervals if well tolerated. So now we also, tend to see that as the dosage of medications are increased, then we may see, of course, greater manifestation of, side effects as well. So it's going to be really important, again, to just continue to monitor the person's response to the medication. And then with the Razidine, there's an initial dose of 8 milligrams a day, which can be, of course, split into divided doses of 4 milligrams twice a day. And that dose can increase to 6 milligrams a day. And you see that that can also be broken into twice a day doses with 8 milligrams, and then 24 milligrams a day. So the individual may take the medication twice a day at minimum 4-week intervals if the medication is well tolerated. So you see a lot of what really the dosage increase is going to depend again on how well the medication is tolerated. So when we talk about how well the medication is tolerated, then we're going to also be looking for those, side effects that occur with the medications and how the person is responding to them. So now let's look at the Namenda. So that initial dose could be 5 milligrams once a day. It may increase to 10 milligrams a day. So they may have a divided dose, split into 2 doses with 5 milligrams a day or 15 milligrams a day. So you see it comes in different dosages, different strengths that will allow different, administration patterns. And then 20 milligrams a day with a 10 milligram tablet that's taken twice a day at minimum 1 week intervals if well tolerated. So when we look at the Namenda, and that's going to be, remember, the combination of the 2 classes of medications, it comes in an extended release capsule. So you see that initial dose of 28 milligrams of memantine and then the 10 milligrams of the donepezil. So you see it's a combination of both medications. So you'll have a dosage of both once a day if stabilized on the memantine and the donepezil. And then if stabilized on the donepezil only, then an initial dose of 7 milligrams. And so you see it can also increase in various increments again if the medication is well tolerated. So let's take a look at some of the various forms that the medications, are manufactured in. So we see that the Aricept can come in a tablet as well as an oral disintegrating tablet. And that's usually one that's, placed under the tongue, and then the medication just, disintegrates, in the mouth. The Exelon, we know what's unique about the Exelon is that it also comes in the transdermal patch and also in the tablet form. Then we have the Razidine that I talked about earlier. In addition to coming in a tablet form, it also comes in an extended release capsule and also a liquid form. Now we have the Namenda. The Namenda comes in a tablet form in addition to an oral solution and an extended release capsule. And the Namenda comes in an extended release capsule. So these various forms of the medication at least give some alternatives in terms of the way that the medications, may be prescribed. And so it's always important, for the caregiver to know in terms of if the tablets, oftentimes it's a case that it's recommended that you not crush tablets. So this is what you'll need to know. This is information to ask the physician, and then you can also inquire from the pharmacist with the extended release capsules. It's recommended, not to, open up, the capsules per se, or try to open up the capsules and then, mix it, in a liquid, because these variations more or less can very well impact how the medication works, within the body, and then also impact the overall efficacy of the medications. So sometimes it may be the case that this information may not be given in this type of specific form. But so this is always good information to ask when we have tablets that are prescribed, or when it comes in a different form with the extended release capsule and even the time released medications. So here's a little more information in terms of dosage and side effects that we all need to be aware of. First of all, that is very important to monitor the individual, especially when any new medication is started. in addition to the medications that are, prescribed for the cognitive symptoms of Alzheimer's. And it's also important, of course, to relay to the various, healthcare providers, because it's usually the case now that medicine has become so specialized that is oftentimes not the case that we only see one primary care physician. Sometimes it's the case that we have multiple specialists that we see. And so it's important always to keep a listing of those medications. Well, what helps now is in terms of we're using more what types of electronic types of documentation, platforms. So oftentimes the medications and, informations in a person's medical record can be, transmitted from one, medical provider to another, well, with permission, but it's always good for the family members to keep a current list of those, medications. And so the dosage is increased based on how well the medication is tolerated. And so that has been, emphasized. And when we talk about tolerated, we're really talking about in terms of the response of various, side effects that the individual may experience. So abrupt cessation of the medication should be avoided. And so what that's saying is that it's advising against not just stopping the medication, all of a sudden. And so if there are some concerns about the medication, well, now it may need to be stopped, abruptly if there are some really serious types of symptoms that are occurring that you need to notify, the healthcare provider about. But outside of that, it's always important to have those, medications really evaluated by the, physician or prescriber, and then in terms of how the medications will be, withdrawn. So side effects, as I mentioned, are generally mild, and they tend to resolve over a period of time on their own. So that's the good news about the side effects. And then, of course, it will be always important to report any unusual symptoms, or if symptoms increase in severity, to the prescribing practitioner. And this is one area that oftentimes, caregivers may not, ordinarily think of, but it's called journaling. So you see the little picture of the notepad per se, because oftentimes in just our day-to-day functions and, our schedules can oftentimes be, very complex. It's good to write down notes, and that's called journaling. And so we make those, interests can be brief, so to speak, that we want to record any type of positive changes that we see that are occurring with the medications, especially in terms of, cognitive symptoms. We want to record those. And then if we record it with a date, then we can, that information can be a lot more specific when we relay it to the physician. So positive changes can be recorded, in addition to if there are any type of onset of any adverse side effects, then to keep a note of those symptoms as they occur. And then over a period of time, of days, we may see that the symptoms will start to lessen, or perhaps new symptoms will surface, or the symptoms will disappear. So then if we keep notes of that, it's a lot easier to be able to communicate that back to the healthcare provider. So in addition to those adverse side effects, we want to also make changes or notations, more or less, in terms of when there is a lack of improvement as well. And so again, that's all of that information is going to be important to the healthcare provider to know. So let's talk a little bit about medication safety as well. So we know that prior to starting a new medication, again, we want to make sure that the healthcare provider is aware of all the medications that the person is taking. And that's not only prescribed medications, but over-the-counter medications as well, because some of those over-the-counter drugs, in addition to prescribed medications, may tend to, interact with medications and result in some undesirable, side effects. We know that the case of polypharmacy, oftentimes exists, with older individuals, and sometimes it's the case that they may have multiple comorbidities that have to be treated with the medications. So it's always good to let the healthcare providers know what those medications are, not only the prescribed medications, but the ones that are, just purchased over the counter without a prescription. So then we want to store medications in a safe place. Sometimes it's the case that persons still have the, medicine cabinets that are in the bathroom per se, that they may store medications in. Well, we know that some of these medications can really be impacted more or less by heat and moisture. So we want to be careful, in essence, where we store the medications. And then, of course, we want to always store them, in a safe place out of reach of, other individuals. And we don't want to, share medications with others. We want to take the medications, have them to take the medications, only as prescribed. And so what that means, especially if a dosage of, medication is missed, then we don't want to double up on the next dosage of the medications, because again, that can, cause problems. So take it, only as prescribed. And then in terms of to make sure, in essence, if the person does require assistance with taking the medications, that there are some systems that are put in place to be able to allow them, to function as independently as possible, but to give them the support that they need to be able to take those medications safely. So that brings us to some tips for managing medications. Oftentimes just the use of reminders may help as well. So that could be a calendar, sticky notepads that, remind us when it's time to take the medication. We can develop a routine for it. So if it's a medication that has to be taken in the morning, so maybe we're going to have that medication be taken around, like breakfast time, around the same time of the day. So that establishes some routine to it. You can see I have a picture of medication organization system. And so these can be, purchased, in drugstores and all. And so you have some that are divided into the AM dose and PM dose, in the morning and evening dose. And then they also divided separate, containers for the particular days of the week. And so this is just, one example, more or less, of a medication organizing system that can be used. But many family members tend to find these, very useful. And then you can also, talk with the pharmacist in terms of other types of pill organizers that may be available and that may work better with whatever particular dosing that may be required, or how many times a day for dosage administration based on your unique situation. So now we've talked about, the medications that have been approved by the FDA to treat the cognitive symptoms of Alzheimer's disease. Of course, that they don't cure the disease, and they can't stop or reverse the disease process. But I already had this slide, in the presentation before the breaking news came out recently about the treatment horizon. And so there was a hope for future drugs that may change or delay the progression of the disease process. So we know that drugs that aim to change the underlying biology of the disease, and so these are medications that have a goal of slowing down or stopping its progression. So we know that recently the FDA approved a medication, Aducanumab, as the first disease-modifying therapy for Alzheimer's disease. And so we know that that was really exciting breakthrough and news alerts that came out from all the various media forms and channels, because this has been a breakthrough that we've been looking for a long, long time. And so this is the first medication that has actually been approved in this particular class of medications. So again, this is the first FDA-approved therapy to potentially delay the decline from the disease compared to other medications that only address the symptoms, because this medication is really getting at the underlying cause of the disease. So now, we've talked about the chemical transmitters, in the brain that the FDA approved, the other medications tend to target in terms of the cholinesterase and the glutamate. So now this particular drug, we know that some of the characteristic hallmark changes that occur in the brains of persons with Alzheimer's disease, right, is this accumulation of amyloid a protein that occurs within the brain, and then we also have the tau or the tangles that occur within the brain. And so the amyloid plaques occur outside of the neurons, and then the tangles occur, inside the neurons, but it damages, of course, the brain cells. So now this particular medication, again, is that we need to emphasize that it's not a cure, but it's an important advancement in the treatment, of course, for Alzheimer's disease. And it has not been tested on persons with more advanced cases of dementia. It has been really targeted in terms of clinical trials with persons who are in the more, mild stages of the disease process. But, that's why it's so very important really to seek what an early assessment and diagnosis of Alzheimer's disease, because then the appropriate treatment can be initiated right at the stage in the illness when it would be most effective, when the treatment would be most effective. So now the first therapy, again, with this particular medication, to demonstrate that removing amyloid from the brain can actually delay the decline in persons with Alzheimer's disease. And so that's the difference, more or less, in terms of how these various medications work. Now we need to know that this medication right now is administered in intravenous form, IV form. And so, of course, its administration is different. It's not in a pill form right now. And the person has to have an approved, diagnosis of Alzheimer's disease. And you can, visit the Alzheimer's Association's, website. And there's, recent information, of course, that was posted to the site right at the time that all of us heard about the breakthrough. Now we know that there's some, controversy about the, medication in terms of the level of efficacy of the medications, maybe based on results from, clinical trials. But we know that family members have been waiting, for decades for a potential treatment like this to emerge, because all of us are interested in gaining more time for the person, with Alzheimer's disease. So right now, the medication is approved, and according through information on the Alzheimer's, website, is that they're going to be also, working to make sure that people do have accessibility to the medications. And so, of course, for more information about the drug, again, you can visit the Alzheimer's website. And then if you have, concerns about it as caregivers as well, then most certainly, talk with your healthcare provider, treating physician about the medication. So this really ends my presentation. And so now, I'll open up. We have a little time left that we can have for questions and answers. And, hopefully the information that I presented to you today will, allow for a better understanding of these medications that we hear so much about and that are prescribed for our loved ones with Alzheimer's disease. And then the exciting, because look, if I would have given this presentation a week ago, I would not have had those last couple of slides to share about this, recent, breakthrough that's been in the making for years and years, although we were waiting for an announcement, to come out like on January the 3rd or the 4th or so. But look, so now here we are. So we're almost in a different era of treatment, more or less, for Alzheimer's disease.
Thank you so much, Dr. Spurlock. This was a wonderfully informative presentation, and I agree. Talk about perfect timing with the release of this new drug therapy. So we do have a number of questions. So we'll try to get through as many as we can. So the first question is there a medical test to check or determine the chemical levels that shows how much glutamate or acetylcholine is in the brain?
I don't really know of any medical tests that can really, determine that per se. I'm not aware of, at least. But we know that those are just changes that occur within the brain of persons, with Alzheimer's disease. And we know that the, death to the brain cells will occur over a period of time. And we can see in terms of on, PET scans and MRIs and all of the brain, brain shrinkage that will occur, over a period of time, or, the atrophy.
Thank you. Another one we have is, how often should I have my loved one's medications evaluated?
Well, that's really going to be decided on an individual basis with the treating, physician. So generally, when a person is put on, medications such as this, is that they're going to be involved in, in follow-up care. And so I would just say to, make sure that those, appointments are kept, or that if you, as a caregiver, may have concerns about your loved one and how they may be responding to medications, then you can always seek to get, an earlier appointment or additional appointments to, address whatever concerns that you might have.
Thank you. Okay, we have a comment from Pam. She agreed with you on the journaling. She said journaling is a good idea, especially when several caregivers, family members are providing care. It cuts down on confusion. So thank you, Pam, for sharing that.
Right. And that information can also be shared among other family members as well, because usually, it's the case that maybe one or two individuals may emerge as the primary, caregivers per se, and maybe they are the loved one that's living at home, that's the closest, maybe retired and more flexibility to take on those responsibilities. And then other family members who live away, of course, they don't have that type of, interface, with the loved one, and they may not really be able to see, the changes that are occurring because they aren't spending that amount of concentrated time with them. So sharing that, journaling, I think, among family members and healthcare providers is also beneficial.
Definitely. Thank you. Okay, here's another question. How long should a person be on any of these medications? 1 to 5 years? I know the physician or neurologist determines which med to prescribe, but is it normal or reasonable for 2 or more years on these medications?
Yeah, we do tend to see in terms of differences in how the medications are prescribed, although we know, over a period of time, the medications will lose, their effect. But oftentimes, if we, have seen some benefit, with the medications, is that they may be prescribed all the way through, possibly through the moderate, stages, of the illness, and even into the, more, severe stages. So I think that's all really, decided by the physician in terms of, and their knowledge of the, individual, and how they are responding, to the medications. Because, sometimes it's the case that if the medications at least have shown some amount of benefit, then it's best just to sometimes to keep them on the medications rather than to take them off and then see some, loss and gains that, have been made. But we tend to see it from, both perspectives in terms of a limited time that the medication is prescribed, and some will prescribe it for a longer period of time. So I think those are really conversations to have with the treating physician, and in terms of their, underlying rationale for continuing the medication or from, stopping it.
Thank you. We have another question. My husband is in the late stages of Alzheimer's and is taking Aricept. Should I ask his doctor about changing to Exelon or meds for later stages of medication?
Well, it's not to say that any of these medications are really any more effective per se than others, but that it just allows, different alternatives, more or less, in terms of treatment. So some physicians would take the perspective, if the person is really responding to the medication, to the Aricept, to the and not really having adverse types of side effects and all, just to maintain them on that particular medication. But again, that's always a conversation, to be had. And then I think the physician will be able to give their, rationale more or less, so that the family member would understand, reasonings behind, keeping on one particular medication as opposed to switching, to another. And that they generally, those cholinesterase medications are going to work in the same way, so to speak, in terms of targeting those chemical messengers.
Great, thank you. Another question. Exciting news about the approval of the new Alzheimer's drug. Can you explain the controversy surrounding the approval?
Well, I think some of the controversy, at least that I've heard about and read about, had to do with the clinical trials, with the findings, the results from the clinical trials for the medication. And I think at one time, the clinical trial had actually been halted because it was reported more or less that they didn't see any significant difference or effect in persons who had been given the medication, compared to those in the, control group, or they didn't see any, significant improvement. But then what later reports then came back, so they went back and looked at in terms of, I guess, the methodology that was used or how the data had been interpreted. And so once they went back and, reanalyzed it, interpreted it again, is that they did see that there was some, noticeable, there was some improvement in persons who had been given the medication. And so then they were given, the okay again to resume the, clinical trials. And so when it went back to the FDA to approve the medication, they did. But now it's also my understanding that what advisory groups that advise FDA is that they may have advised against maybe the medication, but the FDA, did approve it, is that they have the final, approval process. And I know, the way that family members, see it, of course, is that, any medication that might have the possibility, more or less, of giving some additional time to a person, with Alzheimer's disease, in terms of to be able to have a positive, impact on their cognitive symptoms, then, they want their family member at least to have accessibility, to that medications. And it's not to say that controversies haven't existed over other medications that have been approved by the FDA as well. But I think if you go to some of the news websites and the Alzheimer's websites again, there are articles that are posted that can give you some more detailed information about that. But I guess the important thing is that the FDA did approve it.
Thank you so much. Now we have another question, but if it's okay, Dr. Spurlock, I do want to respect your time. I know we're a little bit after, so I'll email it to you and then I can send the responses out. And we do have another participant who says she sent you a couple of questions in your direct mailbox.
Okay.
So if you get an answer to them, let me know and I'll send you their contact information as well.
Sure.
Okay, but thank you so much, Dr. Spurlock. This was such a wonderful presentation. I've saved all the comments in the chat, so I'll be sure to share them with you and any questions that we didn't get to. But thank you so much. This was wonderful. And
thank you for giving me the opportunity. And I'm just so pleased to see the familiar faces and names, some that I know and that I don't know. But look, at the end of the day, we're all in this together.
That's right.
All in this together.
Thank you so much. And thank you to everybody who joined. We look forward to seeing y'all next month. Everybody have a good rest of your day.
Bye-bye.
Thanks so much.
Okay.